Rural healthcare outcomes in America are substantially worse than those of urban Americans. And a big reason for this is that it's just much harder to get to a hospital.
Because people are so far from where they can get help, because it takes so long for them to get to where they get help, they too often don't get help. And as a result, there are all kinds of awful statistics. If you suffer from cancer, you are more likely to die of that cancer if you live in a rural county than if you live in an urban or a suburban county.
So what the Paradigm Project seeks to do is basically bring the hospital to the patient. And the hospital in this case is really a mobile clinic. So think of a smart van that's outfitted with a lot of medical equipment and high-end technology, and also brings with it a practitioner who comes from the area but doesn't necessarily have the skills or the access to the equipment typically to do specialized procedures.
Our goal is, okay, if we can't get people who are trained in the medical arts to live in the rural settings, let's take the people who are in the rural settings and let's train them to be the medical technicians that run the van.
We are part of the task that's called real-time task guidance. You have a person, the practitioner, who is performing a procedure, and you have a usually wearable AI system that's also integrated with cameras in the van, watching their movements, and it provides them real-time guidance. Say someone is performing an ultrasound scan, and they're not that familiar with the ultrasound procedure. Our algorithm should be able to watch how they are positioning the probe, for example, watch that, also read out the image that's on the screen, see the quality of that image, and give them real-time, fine-grained guidance, like where they should move it, if they should go in for more depth, in order to get a high-quality image that's available for good diagnosis. This would involve, at a high level, walking people through the steps. So something as simple as did you wash your hands before starting the procedure? Or it could be as fine-grained as trying to interpret in real time how familiar the person is with the procedure to decide what level of guidance they need. Do they simply need to be told to move to the left, or do they need to be given, move to this specific location, go in at this amount of depth to know how to get a good quality image?
This works in conjunction with telemedicine, right? So you come up, you get a blood draw, maybe you get the sonogram, all that data is going back immediately to someone remotely in a hospital setting who can read the numbers, make sense of them, on the spot say, oh wait, that doesn't look good, okay, I want you to also run this other test, right? So it's interactive, but they're taking advantage of the expertise that's in the hospital setting, but just being able to deliver it to the patient where they live.
So ARPA-H wants, at the end of the 5-year program, they actually want to have vans that are outfitted with this technology, and these people who are being upskilled in real time to go out, basically park the van in their front yard and bring them out, treat them, and then go off to the next patient. So to have something that, if successful, is going to roll out in 5 years and actually be at people's doorsteps, it's very much creating a new, no pun intended, paradigm in medical care that really could be transformative, and it's really exciting to be a part of that.